Welcome everybody, it's Dr. Eli again. It's the end of the year and I thought we would just summarize what we're trying to accomplish and review the things that we have learned up to now about jaw and muscle sprain strain, the concept of speed to treat, and the idea of what we haven't yet introduced, which is called the SAFE protocol. So if you think about things that we use in dentistry, there is a number of items that we typically use that are directly a negative impact on the muscles and the jaw joint. So, negative impact on the muscles, this fine device, anesthetic agents delivered into a muscle tissue are myotoxic. So when you do a mandibular block and you successfully pierce the medial pterygoid muscle, followed by having a person open their mouth and stay open for 45 minutes to an hour, it's no wonder that many times people will have a strain injury to that muscle from the procedure itself. So if a person is given mouth prop, that is not necessarily going to be helpful universally. It's going to put some strain on the opposite side joint and distract the ipsilateral joint. So if a person were to call your office post a procedure, what we are advocating is that you pre-procedure use a millimeter ruler and get a pre-procedure millimeter rule indices on what maximum pain-free jaw opening is. That is going to be a great reference point if they do in fact develop a problem. So remember, normal mandibular mobility is between 40 and 50 millimeters. Measured like this, most people will use a 3-finger measuring tool as well. Most people's 3 fingers are about 45 millimeters in opening. If a person does develop postoperative symptoms, we advocate that you bring them back into the office, get a new millimeter measure so you have a reference point of what the injury was, location, what your measured intensity and loss of range of motion is, develop or use of a QuickSplint placed on that day to be used to eliminate nighttime parafunctional impacts, and then during the day we have made up jaw exercises to minimize or limit the amount of muscle splinting that occurs secondary to the sprain strain injury. So we'll be talking about this more and more on our ongoing chats here. I wish everybody a Merry Christmas and Happy New Year, and we'll be back in touch next year.